When we think of social work, we think of helping people and connecting them to the resources they need. At Erikson Institute, we also approach social work with the goal of community empowerment and changing systems. Dr. Francisco Lozornio, Assistant Professor for Erikson's Social Work Graduate Program, tells us more.
At its core, social work is about relationships. Without community, it loses its heart. When social work is not grounded in community, it risks becoming disconnected from the people it's meant to serve. Decisions are made in offices rather than in relationships. Social workers may rely on theories or policies that sound good on paper but don't reflect people's real lives, strengths, or cultural wisdom.
Taking a community-centered approach doesn't just help prepare future social workers, it's also strengthening Erikson's connection with organizations on the ground. One of those partners is Centro Sanar, located on Chicago's southwest side. They provide critical mental health services to adults who are uninsured or underinsured. As their work has grown over the past 5 years, they've partnered with Erikson to help build out their family therapy program. Edwin Martinez, Executive Director, talks about the center's work with Erikson.
So Francisco brought a non-oppressive approach in that he listened to us first, right? It sounds simple enough, but he listened. He listened to the experts in the room and hearing about what we're experiencing with families, hearing about what our therapists are working through and struggling with on a programmatic perspective, and how that listening and that hearing us, right? Like he's been able to really encapsulate all those interviews and all that knowledge, right, to be able to offer what is actually beneficial for us as a program as well. And at that point, providing evidence-based practices and approaches and helping us develop what our family therapy manual and model looks like. Whenever we work with higher ed institutions, right, it may become conflictual, or maybe like it may be transactional or maybe one directional relationship. So for us at Erikson was I would say like more of a breath of fresh air in terms of like what a actual true partnership could look like with a higher ed institution, especially in regards to providing mental health services in community-based settings.
Dr. Lozornio, or Dr. Francisco, as he is known in the community and amongst his students, places a strong emphasis on the need for social workers to walk alongside communities.
When social workers are embedded in the community, they stop being outsiders who come in to fix problems. Instead, they become partners. They listen more, they learn more, they begin to see people not as cases, but as neighbors, parents, youth, and leaders. I often share my grandmother's wisdom with students. When I was a child, she always used to tell me that I needed to learn to listen with my heart and not with my ears.
Dr. Lozornio heads up Erikson's Roots Initiative, which stands for Restoring Opportunities and Overcoming Trauma Systemically. He and a team of clinicians work alongside residents and leaders in Chicago's Southwest neighborhoods. They share the benefits of mental health practices and provide Circle of Security workshops where residents are provided with guidance on ways to heal trauma, strengthen emotional bonds, and build homes where children feel safe to explore the world, knowing they have a secure place to return.
Communities are not empty vessels. They already hold knowledge, resilience, history, and solutions. When we don't listen, we miss that. And when we miss that, our work becomes less effective and less human.
The workshops are gaining visibility, particularly by word of mouth, which is often the most effective and trusted method to promote mental health services and overcome stigma. For Erikson students like Michelle Ramirez, who's in the social work program, the workshop serves as a template for her own practice, serving both the Cicero and Berwyn communities. She works as a family engagement specialist who ensures families have a voice at the table and that their experiences are always centered.
It's all a labor of love. So this isn't a 9 to 5. I always tell partners, this is not my 9 to 5, right? I live here. I grew up here. These are my neighbors. My mom still lives down the block from me, my sister, my husband's family. So I think it's so personal, and you have to be invested in the community. Otherwise, it's easy to clock in and clock out. but that doesn't lead the work. And families feel that connection.
Michelle works directly with families, meeting them where they are and connecting them to resources that make everyday life healthier and more stable. She walks alongside them as they navigate complicated systems, offering guidance, clarity, and support every step of the way.
So we have the Parent Ambassador program. So they are community members and have been around the same kind of nonprofit work for a while. We have a couple, some are at like 10 years, I think, of working in this kind of area, and some a little bit less, or, it just kind of depends. But because they are the community, right? And many of us do still live in the community, is always making sure that we ask for their opinions, ask for their perspectives.
In her work with families, the lessons from Erikson show up every day.
We do know that when we think about children, we also have to think about the family as a whole. We know that if children are okay, then that means that the adults that surround them are okay, and therefore the community.
When asked what really makes community collaboration work, the spark that turns partnerships into progress, Edwin, Michelle, and Dr. Lozornio shared their perspectives.
I would say it's responsiveness. It's around cultural humility. I think I've mentioned Francisco's name a lot, but I also think about like the people that Erikson chooses to hire in terms of the approach that they take, the willingness to learn, and I think it's synergy in terms of the organization, because we operate the same way. We want to learn, we want to be able to support, but we also want to engage in relationships that aren't transactional, and Erikson provides that. And for us, it's around really, that's where we see the magic happen in terms of being in authentic relationships and communicating and following through and things of that nature. It sounds simple enough, but that's where it's the most effective.
It's part of the culture for sure, like having this close-knit dynamic. Yeah, I think like that magic, right? What leads this work, it's being genuinely interested in the families.
The magic is trust, and trust is built through consistency, humility, and just showing up. Not just when there's a grant or a project, but over time. Community collaboration works when social workers are willing to listen without an agenda, when they recognize that community members are experts in their own experience, when relationships come before outcomes. It's also about mutual transformation. Community collaboration isn't just about changing communities, it changes us. It reshapes how we see the world, how we understand resilience, and how we understand our role as social workers. The magic isn't in the programs, it's in the relationships.